Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, For Wives Only Seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
A warm welcome to you. It's the Amazing Power of Women broadcast. It's another Thursday, and we are here with another episode, an exciting episode for you today. As we say, the Amazing Power of Woman broadcast is because of this book, The Amazing Power of Woman, written by Pastor Chooks of Gynae Ugohe. My name is Toyin Ugohe. Pastor Chooks, just say a word of greeting.
Hello. Welcome. It's another time to engage together and share some things about the amazing power that God has put inside of you.
And yes, it is the last Thursday of the month, and as you should know, if you have been watching this broadcast, it is our Ask Your Gynae Thursday. That's where we bring our resident gynecologist, and she takes a topic and just explains and just gives us wisdom, or rather just explains it from the medical side, so we can have a better understanding of our bodies, better understanding of how to take care of our bodies. You know, like we say, this show talks to the three aspects of a woman: her spirit, her soul, and her body. So the last Thursday of every month, we bring topics to help us take care of our bodies better. Pastor Chooks, over to you.
So what are we dealing with today? Ask Your Gynae session. We are dealing with taking care of her lady parts, or taking care of your lady parts.
Yes.
And we have on hand, just coming up now, resident gynecologist, Dr. Audrey Gugu Gamedze. Dr. Gamedze is going to be sharing with us some of the things we need to know about taking care of the lady parts. And we're going to hand over to Dr. Gamedze almost now.
Yes.
Right?
So just those misconceptions, or just to affirm some of the things you're doing, so you have a better understanding what it is, because some of those things, it's been passed through from your mom or somewhere, but you're not sure exactly what is right and what is medically accurate. So that's what we're going to be dealing with today. And so she will just come up shortly. We will just do a short ad to introduce her, and then we'll have Dr. Gamedze. Have a beautiful one with us.
Yes. So Dr. Gamedze, thank you so much for being on the show again tonight.
Yes.
And we're looking forward to an amazing teaching from you. The gift of God to teach and to instruct is really strong on you, and we appreciate you. We celebrate you. Thank you for making time for the ladies, for ministering here on this platform. We really, really salute you. Thank you for what you're going to share with us tonight. Over to you, Dr. Gamedze.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman, and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Women broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
Good evening to our listeners. A special word of gratitude to my pastors, Pastor Toyin and Pastor Chooks, for the opportunity yet again to minister to lovely women about taking care of lady parts. We made this topic just to bring a sort of curiosity as to what do we mean by lady parts. Lady parts is the whole of you, starting from head right to the toe. But as a gynecologist, I've got a special area of focus that is taking care of what is your reproductive organs. Taking care actually starts from the way you see yourself, the way you view yourself, the way you feed yourself, the way you seek attention around yourself, up to the time when it comes to the actual use of your body parts as a woman. So it's a very robust topic. Let's see how we go and let's see how much we can cover. So for the purposes of this talk, I am not going to cover mental health. I am not going to cover nutritional health. I am not going to cover spiritual care. I'm very happy that I'm in the company of my pastors who know exactly how does a woman takes care of her spiritual health. And that forms a huge component of how you view yourself as a woman and also how you conduct yourself as a woman. So I'll just concentrate on the fleshy part because the stake is where I dwell. I am a gynecologist by profession. Okay, so taking care of your lady parts or your intimate parts as a woman starts from as early as you can take care of yourself. That is around the age of puberty. I'm gonna focus on cleanliness, and cleanliness involves around the time of pre-sexual debut, sexual debut, after you've had children or postpartum, and also in the menopause, to see how the different stages of your life impact on overall care of your intimate areas as a woman. So it is very, very important to service yourself as a woman. Where you feel that you are uncomfortable or you lack knowledge, it is important that you outsource knowledge. It is so scriptural that younger women must learn from the older women, or mothers must teach their daughters. The word of God alludes to that. So we're very much happy that in this platform, we can be able to teach women how to take care of themselves. So washing, having a bath forms part of taking care of yourself. This is applicable throughout all the stages of life. When we wash the vagina as women, it is important to know that you need to use mild soap. Now, healthcare workers recommend mild soap for the whole of your body. So every time you buy your soap, you must see that it is a mild soap or a natural soap with less fragrance and less preservatives. That also helps to keep you as a woman less prone to having allergic reactions, where maybe you can find yourself having a rash or having an unnecessary odor because of a reaction to the deodorant that is in the soap. So how often should you wash yourself? I've heard ladies saying that every time they go to the toilet, they need to wash. For me as a gynecologist, it's very important to allude to the fact that we've got germs that live in our vagina and in the vulva. By vulva, I mean the area outside in between your lips. So it's very, very important to know that the more you expose yourself to detergents, the more you expose yourself to water, you are actually altering the family of colonies that stay in your vulva and in your vaginal area. Those are important for defense. So you've got bacteria that stay there, you've got yeast that stay there in the form of a candida, and also you do have some other smaller colonies or viruses that may stay there. So it is important to understand as a woman that every time you wash, you are disturbing the balance of those colonies. And worse, if you are using a douche. Douche is when you literally wash the inside of the vagina. That is destabilizing to the colony. So washing in the morning and evening is usually enough, and it is not necessary to douche or to wash inside. I always make an example when I speak to ladies in my practice that you do not wash your esophagus or wash your intestines every time you brush your teeth. It is the same with the vagina. You need to wash the outside. You don't need to digitate and go up to clean the inside because you're destabilizing the colonies. Some patients or some ladies, because of allergies, they can wash with water only. But around the time when your body is giving excessive odor, you may find that around the time the odor is a little bit on the intense side. So you can use mild soap. For an example, in our country, we've got Sunlight bar soap, the green soap. You can use that soap to wash your intimate area if you don't have access to other natural soaps. I like to say that when you go to the bathroom as a lady, it is important to wash your hands before and you wash your hands after. The reason for that is the kind of germs that you carry in your hands may not be the kind of germs that are needed in your vulval area. So let me make an example. You are nursing somebody and all of a sudden you feel pressed needing to go to the toilet. If you go to the bathroom, you'll use the same hands that you've been using immediately after nursing. That can introduce a different kind of flora or different kind of germs to the vagina, resulting in maybe a urinary tract infection or maybe a new form of discharge that you do not know. So it is important to wash your hands before and after visiting the toilet. And also, once you are in the bathroom, please be conscious of how you sit. That forms part of taking care of yourself. If you squat, for an example, and you don't sit on the toilet seat, you are creating an abnormal angle of the pipe that takes the wee from your bladder to the outside. If that angle is too sharp, then it will result in your bladder not emptying completely. That will result in an incomplete emptying and a urinary tract infection or a bladder infection. Sometimes also if you squat, you tend to splash a lot, and that results in whatever detergents they use to clean the toilet coming up either to your bum or directly to your vulval area. You may have a chemical reaction. So it is important that when you get to the bathroom, you sit and you don't squat. Some bathrooms will have a tidy wipe provided where you can clean the seat before you sit down, but it is important that you sit comfortably on the bathroom toilet. In some cultures, it is imperative that whenever you visit the toilet, you wipe yourself or you splash with clean water. I will not venture into cultural variations, but oftentimes what our parents teach us is usually right, and it's usually what has worked for them. Then we make modifications here and there to suit our current lifestyles. So I'm not going to say throw away everything that mommy told you. It is very important. And then when you go for a bath now, I've said that washing, it's enough to do it in the morning and evening. We discourage using foam bath when you take a bath. The reason for that is because the vagina acts as a suction area for some reason. So when you are sitting in the bath and you are making movements, washing yourself, sometimes you find that that water which has the foam bath seeps into your vagina and it disorganizes the flora in there. So most people who use foam bath will come to me complaining of oftentimes thrush, which is a yeast infection, each discharge. So it is important, if you can afford to have a shower is much more preferable. Where you do not have a shower, in your bath water, do not add a foam bath or any sort of liquid soap. I mean, any form of liquid soap that will usually affect the kind of flora or the kind of society that stays inside the vagina. I've heard a story about shaving as part of hygiene. I would say that shaving is recommended as part of your hygiene if you are a person that is used to shaving. So as a gynae, I do not have an imperative to say it is right or it is wrong. Everything that we do has got its pros and cons. So if you are used to shaving, shaving may form part of your hygiene. So it is recommended that you do shave, more especially for people who sweat excessively. If you sweat excessively in your vulval area, you may shave so that there is a little bit of circulation there. Secondly, the sweat glands in the vulval area tends to release an intense body odor. That will be the same with your axilla or with your armpits. You will get a very intense body odor. So if you can clip instead of shaving close to the skin, or you wax. If I speak like that, I know that it now sets a financial trend. Some people say, but doctor, shaving may cost me because I need to shave with a cream and so on. Simple clipping. You take a pair of scissors, you clip the top hair that is beginning to knit to each other. That will give enough room for air to circulate there. And also, if you clip your hair, it tends to help prevent ingrown hair. If you shave deeply closer to the skin, that can result in ingrown hair and start a new can of worms or a new disease profile where you get now inflammation, a folliculitis, some small bumps, abscesses. So it is very, very important that you clip your hair or you wax. When they do waxing, they actually take out the hair right from the very, very bottom where it is growing out, and that helps to eventually stop hair growth in the vulval area. So what did the doctor say about shaving? She said that it may form part of your hygiene if you are a very hairy person, but it is not a necessary thing to do. And if you are prone to developing the bumps of after shaving, I would recommend that please do see your skin doctor before you start shaving. Or a housewife's advice would be, number one, you can get an aspirin, which is a disprin, dissolve it in water, and make sure that you wipe the area that you're going to shave. That will help reduce the inflammation. And then you use that same solution every day for about 3 days. That will reduce the inflammation. And then once the hair starts growing, it is very important as well to monitor that it doesn't grow into each other's follicles, and that can result in an inflammation. So that is important. If you've got a very, very strong odor, please do consult. There are ways that we can use to reduce strong body odor, and usually that will not respond even to your normal deodorant. You'll bath nicely, apply your deodorant, and still find that that odor stays on. So please do consult. There is help that is available. And then, what are the other things that we need to do around the time of pregnancy and around the time after delivery? These are extra things now. Around the time of pregnancy, as a woman, you must know that it is difficult to get to your vulva. It is very, very difficult. So when you are washing, please do pay a little bit of attention. Secondary to that is that you are releasing a lot of growth hormones. So let me make an example. Some ladies, you find that they have overgrowth of pimples because their skin is so oily. That is applicable to your vulval area as well. It becomes so oily. When you look through a mirror, you will see that there is a deposit of white cream-like substance on your labias, between the labia, the big ones outside, and the small ones inside. So to remove that, you may need to use a little bit of soap, or you may need to wipe a little bit more intense. So it is important to know about that. Secondly, the discharge may change during pregnancy. Please do note that the white color of the discharge is normal, and that it must not be itchy, it must not be smelly. If the discharge changes to a green or a yellow color, that is abnormal. It may require you to seek medical attention. So in pregnancy, like we've mentioned, the nose is very sensitive. If you feel that the discharge is very offensive, please do consult. Or if your family members reassure you that it's actually not offensive, then that is most likely true. The discharge is not offensive. It is important to know that if it's itchy, that is a sign that you need medical attention. If the color is green, it is a sign that you need medical attention. Just around that time, there are ladies who may decide not to wear the underwear at all because it may be irritating during pregnancy or so, and they want to put on panty liners. It becomes difficult. I may say use or do what will work out for you, but the discharge is so much copious around pregnancy that it may even go down your legs. If it does do that, imagine you are in the taxi or you are in church, you stand up and you are already stained by a discharge. So you may use a panty liner around that time. The important thing is that you must make sure that you change it very often to prevent any unexpected or extended periods of moisture in the vulval area, which can lead to having irritation of the skin. Someone may ask, is it okay to wear a certain type of material as underwear and so on? As doctors, we do recommend cotton for underwear. The reason for cotton is that it is rebreathable. But unfortunately, cotton doesn't have the look that you may want as a woman when you are dressed up, matching bra, matching underwear, silk, lace here and there. So I always recommend that for hygienic purposes, make sure that at least the kind of underwear that you have has a cotton pad. That cotton pad is the small piece that is usually at the base of the underwear. But cotton is the most recommendable rebreathable underwear. But of course, you will not find it in any other more stylish way like your laces would look like. So there will be a little bit of compromise as a lady that you'll have to make. Health over looks. And if you need to dress up for that favorite evening, then yes, you may wear your special fabric. Around the time of menstruation, extended care is also important. Just before I go on to my next point around taking care of yourself after pregnancy or after delivery, may I just speak about taking care of yourself around the time of menstruation. So there are various ways. Some of them are traditional, some of them are cosmopolitan as to how do you dress yourself up or how do you take care of that wonderful event called menstruation. It happens once a month. It will last you about a day up to 7 days. And in more abnormal cases, it may be extended beyond 7 days. but how do you take care of yourself around that time? It is a heightened state of metabolism in your body. So you are releasing a lot of odor, you are bleeding, you may experience mood disorders, which can make you even much more untidy because you don't want to have a bath, you just want to keep sleeping. So as a woman around that time, you need to be extra vigilant. Menstruation is a beautiful season, like I've mentioned. It is also a costly season of a woman's life because you need to spend on pads. There are other ways available that you can use to contain that menstrual blood. So some ladies use pads, which look like smaller pillows that you stick onto your underwear, preferably ones that have got wings because they tend to contain the overflow. And then at night, it's important that you look for a size that will go up to your pubic area. There is that small bone there where your pubic hair starts. If you can get a pad that reaches up to that area, if you go according to the known brands, you will find that it's written Maxi and it's extra long. That usually covers you nicely to make sure that you don't soil your linen at night or you don't soil yourself around the days of heavy flow. Other ladies use tampons. Tampons are like small plugs that you shove up the vaginal canal, and as they absorb the blood, they tend to expand inside the vagina. When they are full, they will give a sound. If you are not used to wearing them, like somebody is puffing, like that can happen if it's full and it is ready to come out. So they also come in different sizes to fit the vaginal canal. Teens can have tampons from the size of extra small, although if you haven't broken your virginity, you need to use tampons with caution, more especially because you will not know the kind of hymen that you have. Most women have an open hymen. That is, you can't be able to push the tampon up. Others will have a more tighter hymen, which can break when they push or pull out a tampon. So if you haven't yet broken your virginity, it is very important that you are mindful as to how you use tampons. And then I was just saying that they come in different sizes to match the flow and to match the size of the vaginal canal. The other thing that is now popular for use is the menstrual cup. The menstrual cup, it is a small cup with a plunger at the back that you can use to either apply or pull it out. If you use a menstrual cup, the first few times you use it can have glitches of overflow, not because it's full, but because of positioning. So it is the most recommended because of hygiene purposes. Number one, you buy it only once and you can use it for the longest long. And secondly, the material it's made of is silicone, which you rarely get an irritation from it. Thirdly, it is cost effective when you count the overall number of uses that you can use it. So application is the most important thing. A gynae can apply it for you, but when you need to change, you need to know that actually if I apply it this way, it holds on. So most ladies who use the menstrual cup, you find that they change it twice a day. That is, you put it in the morning, you empty it in the evening when you have a bath, and you sight on a new one to use overnight and you change in the morning. It's actually very, very cost effective. So I was just saying the material that you use around menstruation can be influenced by cost, can influence by availability. It can also be influenced by tradition. There are some people whom traditionally around the time of your menstruation, you don't move around. You just sit in one place so that you don't need to use a lot of material to take care of yourselves during that time. But the modern woman moves around, the modern woman swim, the modern woman is involved in gymnastics. Like there's a lot that we need to do around that period. So find sanitary wear that will suit your needs. The old school cloth, it still works. The best material to use around the time of menstruation will be the vest-like material. It's got high absorption and also it's made of cotton. It will not affect your skin sensitivity. That is menstruation. Is it important that around the time of menstruation, you stick up your finger to wash inside, or you take a hose pipe to clean the blood inside? No, the vagina is a self-cleaning material. So around your period, washing the outside of your vulva is enough. You don't need to go inside. Anything that is trapped inside, could it be clots, could it be mucus, it will eventually come out. That is why most ladies will describe their menstruation as, I get a brown discharge and then the menstruation followed by a brown discharge. The brown discharge is actually blood that has been stuck higher up, gradually coming out. So menstruation is an important hygienic time. Please do remember that your odor is heightened around that time. And secondly, if you have a lot of hair, you may need to trim around that time to make sure that the menstrual fluid doesn't get stuck onto the hair or onto your pubic hair. And then how do I take care of myself after delivering? So the important point there is, how did you give birth? If you've given birth normally via a normal vaginal delivery, you may sustain some stretch tears or you might have been cut. It is a difficult time to take care of yourself because you may have a newborn who is demanding. Secondly, pain control may not be that adequate. Thirdly, you may find that you are not having enough sleep or enough help. So intimate care is not that possible. So I will take a scenario where you find that you've had an extended cut, which we call an episiotomy. That cut needs you to soak at least every 4 to 6 hours. You soak yourself in salty water. You can soak yourself in betadine salty water. That is just to make sure that you are clean. And then a very funny thing that I learned from the midwives and also from some of the ladies is that you can actually use a hair dryer. You put it on very hot and then you use it to sort of massage that area. So it acts as a heat compressor and that helps you to heal faster. And second, because the heat will motivate your body to bring good supply of blood, and also the heat will keep the vulval area very dry, hence enhancing the healing. So if you don't have anything to use after you've just done your salt bath, you just take your dryer, you use that hot air to dry yourself. And also if you can afford, please don't wear an underwear. Because it tends to retain the fluid and also it retains a lot of moisture, which can delay your healing. The tricky thing is that you are still having a lot of flow from the womb. So if you can have moments where you are just sitting and you open up your legs, don't wear tights underneath. Some ladies, there will be a pad, there's a panty, there's tights, and then there's tight jeans. That does not allow ventilation to your vaginal area. So if you can, just wear flowing skirts. That's why we've got skirts, to make sure that you've got enough ventilation in your vaginal area. If you've sustained some tears, you do the same thing. You use warm, salty water to rinse the vaginal area. Soaking actually makes a huge difference. You just make the water a bit hot, Tepid warm, you sit for around 5 minutes in that water and you get out and then you dry yourself. It is very important. Can I use tampons after I've given birth via normal delivery or via cesarean section? I would say a big no. Let's not use tampons, because what they tend to do is they keep the blood inside that is supposed to come, and it is around an area of very high infection. So it is not recommended to use tampons during that time. So at the interest of time, to keep it very nice and very much desirable to know more about intimate care, let's summarize by saying that a lady needs to practice good vaginal hygiene throughout her life. As a teenage, make sure that you do bath and you are clean, you take care of yourself around the menstrual time. As a woman in her reproductive age, your important times are also around menstrual time, around pregnancy, and also around the time after delivery. Menopausal, we didn't say much about them. They are also very important. The important thing in menopause is to know that your skin is very delicate. A tissue can break your skin. So it is important that you don't wipe when you clean yourself, but you dab just to make sure that your skin is maintained. And we also have some estrogen creams to keep you well lubricated. Sexual intercourse, it is recommended that you do not douche after sexual intercourse. The body has a way of cleaning itself out. Make sure that you use light lubrication as well. Water-based is very important compared to oil-based to prevent irritation, something that you can easily clean. I can say volumes and volumes around intimate care, because it is an area that if it's not taken care of, it can predispose you to a lot of infections as a woman, or it can predispose you to a lot of allergies if we haven't taken good care of. I know, because you love Ask Your Gynae so much, you're going to send me a lot of emails, which we're going to be able to have a second session after that. And Pastor one day will sort out how do you take care of your spiritual life as a woman. May God bless you. Thank you so much for joining us.
The Power of Women Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Women Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za, or for inquiries, call 064 200 1545.